Go.
All right, so this is going to be tube feeding skill. So just like our paper says, we're going to review the PCP's order for type, amount, and flow rate. We're going to bring the necessary equipment to the bedside, perform hand hygiene, PPE, identify patient name and date of birth, close the curtains around the bed or shut the door, elevate the head of the bed at least 30 degrees, and keep the bed elevated at all times during the treatment. Assess the abdomen for distension or any tenderness. Obtain the tube feeding and connecting. So this would be some of the connector set, okay, or this prescribed. So this would be a tube feed set. And you get the prescribed medication, tube feed. We can put that in there. Some cans you can even, like this. This is Jevity. This would be how it comes, and it has its own connector. So we can just hang it upside down and connect it right to the hole from there. Okay, so depending on what you have, then you're going to set the flow rate and turn the pump on, prime the tubing. Okay, so this is a Kangaroo pump. You would turn it on. It says keep settings or clear settings. So maybe if we want to start over, okay. Then it says prime the pump. So you would hit that. Disconnect set from the patient, okay. So you would prime it, meaning put the tube feed into the tubing. Then you can adjust the feed. Feed rate would be, let's say, 100 milliliters per hour maybe. Okay, and then enter. Then volume to be infused. Maybe we want to give, I don't know, 500 mLs. Okay. And then we would hit run. Okay. And when it says that, it's running. Then we can put hold and get a history. Okay, how many it has fed and flushes. Okay, put done. Then you can hit run. You can put resume in how many minutes if you would like to resume it in, say, 20 minutes. Adjust the setting or clear the volume at the end of your shift. Okay. And then let's see, we would check placement of the tube. You're going to aspirate a small amount of stomach contents. If there's no fluids to obtain, instill 20 or 30 of air while auscultating the abdomen. So we put a stethoscope over. Attach the tubing to the pump. Assess the patient's tolerance, making sure that they feel okay. Follow the feed with sterile water. So this would be our flush. Okay, so we're hooking it up to a flush. This is the feed, so you can see the green going through, and then this would be the flush line. Okay, we're going to remove our PPE, perform hand hygiene, and then document the patient's order, how much they received, their rate, and how they're tolerating it. Maybe even assess the site of entry. Make sure that you've documented that you've aspirated, what you aspirated, what residual was there. If there was no residual, that you did a air auscultation with your stethoscope and document that. And obviously we're always documenting the patient's tolerance and doing some education while we're doing it. So this way the patient gets used to it if they have to go home on tube feeding. Okay?